Hello, my dog lovers. Good afternoon, good evening for those of you who are back east or in Europe. I'm here today because I have an important topic to discuss with you or clarify for you. And I also would like to welcome Alicia, my ally in those Facebook Lives. Hi,
Hi,
Alicia.
everyone. Thank you for the welcome. Hi.
Before I started, I rushed around a little bit, so my apology for starting a little late than scheduled. We normally start at 1 p.m. Pacific. Today, we have a really interesting topic, even though it may seem to be boring on the surface once you start diving in and understand the mistakes that happen in diagnosing hypothyroidism. Once you understand that the condition is not just congenital and that your dog is not at mercy of genes, then it will become much more exciting because you will feel empowered by having some solutions and having tools how to address hypothyroidism, understand it better, prevent possibly some of the misdiagnoses, and also how to prevent it. That's an important part. So where do we start? We'll start with the thyroid gland itself. And I have prepared some slides again, as always. I just have to find my slideshow here. Oh my goodness. All right. So I will be sharing slides here and there with you. And a little bit of a moment. I will have to adjust the size. And all right. Let's see. Sharing. Here we go. So thyroid gland is an interesting gland because it is responsible for pretty much everything that happens in the body. It's quite the responsibility if you think about it. Think about you managing everything that is happening in your body. That would be a lot, right? But the thyroid gland does it, as most things in nature, very easily if it's healthy. If it's not healthy, then it's a problem. And glands in the body are kind of interesting part of the whole system because they are the governing little small, tiny soldiers of the body. And if we have soldiers or if we have the crew or staff or team, who is the captain? Who is actually leading everything? I like to compare the hormonal functions in the body to a flight where there is the pilot, the captain, who is kind of responsible for flying the airplane and making the decisions at times of emergency. But there's also the flight center, and there's also the plane itself. I have portrayed the captain on the plane here as a female pilot because I think that female pilots are probably better pilots overall because they're more conscientious and a little more thorough, at least what I've seen, and better drivers too. And I also, just to kind of balance the whole slide here, I put Charles Lindbergh here. He is the first person who crossed the Atlantic Ocean. He was buried in Maui, where he has a grave, and I often come and visit it when I'm in Maui because he was the daredevil. So captains are the ones who are in charge. And then there's the flight center, as I said, and then there's the plane. And when it comes to the hormonal balance of thyroid system, of the thyroid gland, it actually does function quite similarly because there is the flight center, and the flight center in the body is hypothalamus. And see hypothalamus, it's in the brain, and see it as a kind of converter between the emotional and neurological system and the hormonal system. because they do work together. So it's like the flight center, because if hypothalamus gives the captain the captain signals, then obviously there is a connection, there is communication and all that. In the body, the captain would be the pituitary gland, and the plane or the engines would be the thyroid gland. So again, I'm just going to repeat. The hypothalamus is at the top. It's the connection between the nervous system and the hormonal system, and that can be seen as the flight center. Most of the time, the flight center does govern the planes. Most of the time, hypothalamus governs the pituitary gland and the thyroid gland. But if there's an emergency, obviously, or if there's a lack of certain, let's say, fuel in the engine, the captain has to make a decision, and that's the pituitary gland. Now, the pituitary gland is or resides in the brain as well. And it's probably like in this position, somewhere there at the bottom of the brain, and it's the captain. And the captain gives the signals not only to the thyroid gland or the engines of the body, but also the other organs, ovaries, testicles, bones, skin, uterus, kidneys, and mammary glands, and adrenal cortex, and all that. So it's really the captain, right? That's flying the whole body, in quotes. If we look at the engines of the plane, they in the body are the thyroid gland, as I said. So again, I know that it may be a little tiny bit confusing, but here is another kind of detail. So you have the hypothalamus, the converter from nervous system to the hormonal system. Then you have the pituitary gland here in red, which is the captain, and the thyroid gland. I know that I'm repeating myself here a little more than normally, but this is kind of, it's simple, but it may seem complex at the beginning, right? But if you remember, okay, my dog's thyroid system is like the flight control, the captain, and the thyroid gland is like the engines, then it may be a little easier. Now, what do the thyroid hormones or does the thyroid hormone do? There are actually two. That's why I said plural at the beginning. There's the one that is the T4, which is thyroxine. And T4, remember, the T4 has 4 iodine molecules here. 1, 2, 3, 4. And then there is the T3, which is actually, I'm just going to say, stronger, more powerful. And I'll tell you a little more about it later. But it has only 3 molecules. So usually the thyroid gland mostly creates the T4. And then the T3, which is actually stronger, gets converted from T4 in tissues. And there's a whole bunch of conditions that have to happen in order for the conversion happening well. As I said, the T4 is a little less strong, and the T3 is a little more strong. And it's kind of, I'm just going to call it the final version of the hormone that is the most effective. Now, the thyroid hormone is super important in many, many different functions. But the most important part is that it actually fires up the engines of the body, okay? If you don't have thyroid hormone, the body cell cannot burn oxygen, and as a result, it will not function properly. You will see low energy, you will see overweight condition because the body doesn't burn enough. Thyroid hormones are super important in turning glycogen, which is the storage sugar, into glucose, which is the kind of like performance sugar, and that powers the cells. It also breaks down the cholesterol. It improves serotonin, so it improves moods. It increases the heart rate. And it also is responsible for fetal and infant development. So if you have thyroid issues, the whole body is not well. It's a serious condition. That's why we're talking about it. Now, remember, the engines are important, but without the captain, the engines cannot fire up. And without the flight control center, without the hypothalamus, the captain and the plane would not be flying very efficiently and well. Now, the T3, and I'm just going to show you another slide here, is, and Alicia is nodding here. I know that this is kind of exciting and complicated, but I'll make it simple, don't worry. The T3 needs selenium to be produced and converted. The T3 also needs healthy body to be actually produced. And if the body is not healthy, if there is another concurrent disease, T3 is not produced. If there is lack of selenium, T3 is not produced. And that's why I sometimes suggest, if you have a hypothyroid dog, you may want to check your dog's system and see whether there is enough selenium and other minerals. Because even if there is enough thyroid hormone and there are other minerals missing, the body may not function well, and it's kind of like a vicious circle. In this picture, I'm showing you Herky test, which is the test that we suggest or recommend. And it was just a result of me knowing that understanding the mineral levels in the body is super important to overall general health. Here in this test, you can see that the selenium level, the SE, is actually quite high. That usually happens when there are artificial supplements given. I've seen that with some mobility supplements when the selenium levels are through the roof. So this is not an optimal situation, but you also don't want it to be too low, okay? So if you have a hypothyroid dog, or if you suspect low energy, or if your dog is just sluggish and not well, it's a good idea to start right here to check the mineral levels, and also selenium, because we now know that selenium is needed for production of T3. Now, hypothyroidism. Why are dogs hypothyroid? Well, I already suggested a little bit that there may be some deficiencies, or maybe the captain or the flight control center, the hypothalamus, is not working well. Hypothyroid dogs look like their metabolism is not functioning very well, as you can see. Overweight, skin conditions, poor energy, depression, all those can be actually really present, but not all of them may be present. And sometimes the condition is very hard to diagnose at the beginning. Some people believe that DNA is, or genetics are the most responsible for hypothyroidism, but that is not exactly true. I mentioned that several times before in different broadcasts that the genes are responsible for roughly about 15% of the expression of the genes. The rest is epigenetics, meaning that genes will not express. If someone has congenital condition genes, it doesn't necessarily mean that they will express. If you have a gene of cardiac disease or heart attack in the family, it does not necessarily mean that you will have a heart attack or get a heart attack if you live healthy lifestyle, if you exercise, if you see your doctor regularly, and so on and so on. So DNA is definitely predisposing factor or genetics, but not necessarily the only one, and relatively small portion. Now, more importantly, the large dogs are much more likely to have hypothyroidism or be affected by hypothyroidism. And once again, you would think, then it must be DNA, because large breeds have certain DNA or genetic makeup that the small dogs don't have. But there is another factor that plays a role in the large breeds, and I'll tell you in a moment. If you look at the large breeds here, pretty much all of them are predisposed to hypothyroidism. I have not seen poodles being hypothyroid as often and frequent as, let's say, the golden retrievers and the labs and the Great Danes and the giant breeds and the mastiffs and Bernese Mountain Dogs and all that. But definitely, larger breeds are more frequently affected. I thought that it was genetics too, until I discovered that dogs that pull on the leash, which are actually the large breeds because they're stronger, they can develop more force on the leash, they actually get collar injuries. And if you look at the initial slide that I showed you here, the thyroid gland is right under the collar. And the pressure is so huge, it's so big that the thyroid gland gets traumatized. And as a result, it gets inflamed. And when it gets inflamed, then the body goes, hey, there's inflammation, I have to do something about it. And it creates antibodies against the thyroid cells. And when it creates antibodies, what happens? The antibodies bind to the cells, and they destroy the thyroid gland. Dr. Jean Dodds, who is actually a thyroid expert, and she has a lab called Hemopet, has also shared this opinion that collars are actually one of the factors that play a role in occurrence of hypothyroidism. So remember, if you have a large dog, the first thing that you want to do if you want to prevent hypothyroidism is actually to eliminate collars. Again, remember that collars push on the thyroid gland. Every time I see a dog out in the park or in the forest and they're on the leash, they pull like crazy, you know, I can't stop myself by talking to the owners or guardians about hypothyroidism and about the collar damage. And I usually start in some sort of way of, praising the dog for looking good, or the guardian, praising the guardian for the dog looking good and being happy and saying you must love your dog. And then I start about, did you know that collars can actually cause thyroid gland damage? And they're usually much more open than if you start with right away with that comment. There's another predisposing factor that plays a role, and that's playing tug of war. Many people love to play tug of war with their dogs, and dogs love to play tug of war. So this is another predisposing factor that you have to remember. And when you're actually telling people about hypothyroidism and how to prevent it, I wanted to remember this picture. Kibble and diet, other factors that contribute to hypothyroidism. Obviously, we already know that no human doctor recommends processed food to their patients. However, in veterinary industry, it's still happening. And I don't want to get into talking about kibble again. Logically, common sense, we should not be feeding kibble to our dogs. Not only that we don't know where the ingredients come from, but if the food sits on the shelf for 6 to 12 months, it's not good. It oxidizes, it's not fresh, the body really suffers. I've heard some people saying, well, but I cannot afford raw food. And my answer is, you cannot not afford raw food because it's much more expensive to deal with the health conditions, plus the emotional loss and premature aging, seeing your dog depressed and down and overweight and immobile. I don't think that we should be putting money on that. And if, I know that situation has been a little tougher now, but there's always a way. Maybe you have a hunter in the family. Maybe you have overpopulation of deer on an island that you live in or in an area that you live in. Like there are always ways to maybe reduce Starbucks coffee or not buying the big screen TV, whatever it is. Like I always put my dog ahead of everything. By the way, there is a really interesting newsletter coming out this Saturday. If you haven't subscribed to our newsletters on the topic whether humans are more valuable than dogs and other animals. So please sign up or check out the newsletter. Don't forget that. Anyway, kibble. Definitely you want to stop kibble, especially if you have a dog that has a hypothyroid condition. We also talk about deficiencies. Often I talk about deficiencies because, nature never intended us to interrupt the nutrient cycle. In Africa, it would happen really simply. The plants would be eaten by herbivores. Herbivores would be eaten by carnivores. Then everything would go back to soil eventually. And the cycle of nutrients continues. But if we transport nutrients and food on long distances and never bring the compost and the remnants of the plants back to where it came from, we are actually not capable and able, and farmers are not able to supplement the soils with all the minerals and nutrients. That's why the essential nutrients make a huge difference. Everyone knows and understands that tomatoes will not grow if they don't get enough nutrients, or a garden will not grow. Everyone understands it. People fertilize their gardens and they forget that we and our body and our dog's bodies are the same. We cannot build a bike without the parts. We cannot build the body and power the body without minerals and essential nutrients. We cannot fly the plane without fuel either. So the other cause of hypothyroidism may be excessive vaccination. I'm not anti-vaccine completely, but I have developed a system where you really need to give only minimal vaccines and maintain antibodies. Sometimes dogs may not need any distemper parvo vaccines and maintain antibodies for a lifetime. There's an article on that. You can go to my website, and I'm sure that Alicia or Christina, if she's helping as well, will post a link. So vaccines, how do they affect the thyroid gland? Well, if we give, sometimes in the puppy boosters, there's like 20 plus antigens or diseases in the vaccines that we vaccinate against. And it's not a natural situation. Usually the immune system faces one pathogen, not 20 in 3 months. And so the immune system starts freaking out. It gets overwhelmed. It's unhappy, and it starts overreacting. It doesn't feel any different than if you come to a desk like this. If you see something like that, you freak out. At least I would freak out. And if the immune system goes 21 different tasks at the same time, I'm freaking out right now. And if it freaks out and if it overreacts, then it starts turning onto its own body, and part of the body is the thyroid gland. And if the thyroid gland is destroyed and there is autoimmune thyroiditis or inflammation of the thyroid gland, then that may be vaccine related. And once again, Dr. Dodds does suggest minimizing vaccinations. And if Dr. Dodds says that, it must be true. Anyway, how do we diagnose the condition? Diagnosis is a little confusing because it's often flawed. Now, TSH stands for thyroid stimulating hormone. You know what it's produced by? The pituitary gland. The captain produces the TSH. And the TSH says the thyroid gland, produce more, I don't have enough, produce less. So it's almost like the throttle on the plane, when they have the lever and they move it forward or back, and they move it forward and it goes and it takes off. Well, the same thing happens with the body. So the TSH is the captain who moves the lever forward or back, depending how much throttle he needs. But it is not a good indicator. The captain itself cannot fly the plane. The captain itself, if the engines are low, you have to look at the engines, not at the captain, right? Like if they're not, let's say there is lack of fuel, or there's some sort of breakdown, okay? See hypothyroidism as breakdown in the engines in a way. So what do we need to measure? TSH is not a good indicator for determining whether your dog is hypothyroid or not. What we need to measure is thyroid hormones, okay? And there are two thyroid hormones, or two types. One of them is bound and one of them is free. Both of them, the T4 and T3, have these two forms, bound and free. Now, the bound means that the T4 and T3 are bound to proteins. And if you ask the bound T4 and T3 to do something, it cannot do anything. It cannot run to the next tree and pee on it like the doggy here at the post, because it's on the leash and it cannot do much. The free T4 and T3 is free to act, free to do things, okay? So once again, if you measure only the T4 that is bound, you will actually not be measuring the active T4 and T3, which is free. So that's why we're actually looking at comparing the T4, which is bound, or we call it total sometimes, and the free T3 and T4, okay? And I'll explain that further. I said it a minute ago, or maybe 30 seconds ago, that the bound or total T3 and T4 are inactive. They don't reach cells because they're bound to protein. And then the free T3 and T4 stand for about 0.1 of the total T3 and 1% of the total T4, but they're the active forms. And these active forms also inform the captain, the pituitary gland, whether there is enough or not, because it's not bound, and the captain actually is interested in that free energy, the free fuel that is coming to the engines, the thyroid gland in this case. I hope the comparison with the engines and the thyroid gland works for you, because it definitely works for me, and I always remind myself, captain engines, captain engines. Without the engines, we cannot fly. Without the thyroid gland, we cannot have, burning in the body, oxygenation, metabolism. It doesn't happen. So the thyroid gland actually produces the T4. And then it goes to tissues, and that's when it's converted to T3. I said that before, the T4 is about 3 to 4 times less active, less effective than a T3. So we really do want to have T3 in the tissues. But when we are testing, interestingly enough, we actually are testing for the thyroid function. And because the thyroid function or thyroid gland produces the T4, we have to test for that, right? And we test for that by measuring and comparing the T4 and free T4, the total T4 and free T4, right here on the slide. And then we look at the ratios. Is the ratio enough? Is there enough free T4 that is active? Do you remember the free dog versus bound dog here? Now, these are the essential tests. If your vet says, I measured TSH and total T4 and it's fine, you will ask, and how about free T4? I'm interested in that. I'm interested in the ratio between free T4 and total T4, because the free T4 is what powers my dog, powers the engines of my dog, not the bound T4. Dr. So-and-so, I'm sorry, but I just need another level. I just need free T4. And your vet will go, oh my God, this person knows more than I do. Actually, most likely not, but it does happen, and I've seen that. I think that most veterinarians know this information. So here is an example of the test results, and I will actually go through them. So T4, that's the total T4. You can see that it's in the normal range. I blackened out or erased the details of the patient here. Then free T4, you can see that it's in the normal range, which is here. We have 172. This is pretty good. Now we look at the ratio of free T4 and free T4. And the ratio must not be below 125. And we are at 148. It's pretty good. Now the T3, remember that this is actually the tissue total T3, but it's bound, so it doesn't really do much. And the free T3 gets converted from the free T4 here, and it's also normal. So this dog is not hypothyroid. Okay. Good news is that we have negative antibodies against the thyroid gland. Do you remember when I was saying that the thyroid gland can get attacked by the immune system when it's inflamed, injured, or when there is side effect of vaccines? So here we have a pretty good situation. Very, very happy. However, if the tissues are not okay, if there is some sort of problem, and I'll tell you when it may happen, there is some sort of additional disease, injury, fatigue, malnourishment, all those can actually lead, or liver disease can be also the cause. All those can lead to low T3. And if the low T3 is low, then it may mean that it's not hypothyroidism, but there is some sort of tissue issue. We call it NTI, or non-thyroidal disease, or we used to call it sickly thyroid syndrome. So if low T3 is present, it does not necessarily mean that your dog is hypothyroid, especially if the ratio, just gonna go back here, of T4 and free T4 is normal, okay? But you now remember that free T4 and T4 are produced and they travel to tissues where they're transformed into these two. And if tissues are sick or unwell, cells are unwell, the conversion will not happen. So now it kind of closes the circle. Now here you have an interesting situation. I've chosen an example here. Normal thyroid gland hormone, total. Normal free T4. Normal, actually a little higher ratio. So it looks like there is a higher production. There's a higher ratio of the T4 and free T4. And when it's there, we look at T3 and we say, oh, we actually have really low T3. We have really low free T3. You know what it signifies? This is not hypothyroidism. This is a tissue problem or old age or injury or malnutrition, some sort of overall other problem than thyroid problem. And you know what sometimes happens? That these dogs are supplemented with thyroid hormone and they get even worse because the original issue is not addressed. Now, this is another picture just to kind of remind you that collars or excessive vaccination may cause autoimmune disease or creation of autoantibody, antibody against its own cells. But here it is negative, so we don't have an autoimmune condition. Now, some people may ask, so does it matter how old my dog is? Does it matter how big my dog is in the levels of thyroid hormone? Absolutely. Older dogs have lower levels, but they should be still within normal range for that age group. And also bigger dogs have lower levels. Also, sighthounds may have lower levels than small or medium-sized dogs. So how do we treat hypothyroidism? This is the next phase. Or how do we prevent it as well? You want to make sure that dogs get good food. Good food means no kibble, ideally. And if you have to feed kibble, sometimes people ask me, what is a good kibble that you would recommend if I cannot feed raw or cooked? You know, it's like asking what diesel fuel is good for a gasoline engine. There's just no good kibble for a dog. It's not about even the ingredients. It's just about the format and about what dogs were meant to eat or are meant to eat. So this is an example of Pax's dinner, vegetables and meat and some bones. You can use our recipe maker, recipemaker.peterdobias.com. You can create recipes and also the essential nutrients. Now, I formulated these essential supplements because two reasons. I was giving my first dog, Sky, supplements from other companies, and I just wasn't really happy with the results. I also see now the difference between Sky and Pax because Sky got my formulas at age 9, which was almost little too late for him to develop the same way as Pax did. But these are just essential nutrients: minerals, vitamins, probiotics, omegas. Omegas are good for tissue repair. Probiotics are good for the immune system. Multivitamins and vitamins are good for overall body's health. And minerals, similar to tomatoes, are important for the body to grow and have the building blocks and power that is the fuel as well. There's also detox, that if toxins, and I actually forgot to enter toxins as one of the possible elements that are contributing factors. The toxins are everywhere around in the environment, and they affect the metabolism, they alter the metabolism. And once every 6 months or so, we should do a detox, liver detox and overall body detox. And that's where I use Liverturn. Okay, going back. So nutrition is one. And I'm just going to show the slides again. And the next one is harness. Relieve your dog's neck of the stress. Protect your dog's thyroid as if it was nothing more important, if there was nothing more important than the thyroid gland. If you're sitting on a plane and you're flying, what are you going to be worried about the most? That the engines will fail, right? Don't let your dog's engines, the thyroid gland, fail. Protect it. Do not use choke chains. Do not use collars. Do not attach the leash to the collar, period. You know, I must say that Sky used to be on a collar here and there. Pax never gets a leash attached to the collar. He does have a collar to carry his ID and stuff, but I never attached the leash to the collar. The worst form of kind of collars are obviously the prong collars, because they really poke in the thyroid gland. I see a lot of people without those still. Choke chains, but even regular collars. And also the retractable leashes. When dog runs and then you press the brake and it's like a jolt, crazy jolt. I would like to see slow motion what happens to dog when the brake is pressed or when the dog runs to the end of the leash. If you have a hypothyroid dog, or if you want to prevent hypothyroidism, make sure that your dog gets treated by a chiropractor on a regular basis. Massage, neck massage, protect your dog's neck. If your dog has been diagnosed hypothyroid and the ratio of T4 and free T4 are low, and you see that there are definite symptoms, then what you may want to do after you implement these steps that I just mentioned, repeat the test in 4 to 6 weeks. I usually send the test to Hemopet, to Dr. Jean Dotz. She's in the States, but she receives samples from all over the world, and you can talk to your veterinarian. He or she may have an account with Dr. Dotz, or you can send the samples yourself if that is not the case. If you see that your dog is not improving, then if there are no clinical symptoms, you may want to go a little further with the treatment plan, because it may take sometimes months before the body regenerates completely, especially if your dog is middle-aged or older. But if not better, then we go to the next phase, and that's supplementation of the thyroid hormone. Now, if you do supplement, and many people ask me, is thyroid hormone safe? Is it okay? And I'd say see it as a crutch, because if the body loses the ability to produce thyroid hormone, then it's better to have some sort of supplemental engines and provide the power to the body as opposed to not. You know, if there was a plane where the engines fail, and there would be such technology that another plane could actually catch up with that plane and attach another engine, that would be preferable than the plane falling down, right? So we want to do the same thing. We want to supplement the thyroid hormone. And I have not seen really many side effects. As I said, it's almost like a crutch or spare engine that you have. I do recommend supplementation, basically. Some people ask me, so if I give the glandular supplements made of glands from thyroid hormone, from thyroid gland of other animals, would that work? Would that be reliable? I'd say the problem is that dosing cannot be done very easily because there are different levels of hormone in different tissue, and you really want to measure, because if you overdose, the body will actually be kind of concerned about overdosing, and it will start throwing off the T4 out of the body, out of the system, and you may actually see low thyroid hormone levels. It's kind of crazy, but it's almost like an overreaction. So you don't want to give the glandular supplements to correct hypothyroidism, at least in my opinion, because it's not dosed properly. You may either underdose or overdose. You will not have reliable results. I would like to talk about the dosing a little bit more here, because that's something else that you may want to check. As I said, errors happen, and I don't want your dog to be a victim of an error. So ideally, the doses should be 0.1 milligrams or 100 micrograms, but remember 0.1 milligrams per 15 to 20 pounds of optimal weight. So if your dog is overweight, and you want to give a thyroxine dose, or your vet decides that that's the right treatment, then you have to calculate not for the real overweight weight, but for the optimal weight. So you have to estimate it. If your dog is 20 pounds overweight, you have to deduct the 20 pounds from the dose. And the other thing is that you have to give the medication separate from food and supplements, because calcium, for example, may, if you give it together with the calcium-rich food or supplement, then it will inactivate the levothyroxine. And levothyroxine actually stands, it's a T4, but it's artificial manufactured, so we call it levothyroxine or sometimes L-thyroxine. Beware of overdosing, super important. And I kind of showed you here the molecule of the levothyroxine. You can see that it is 1, 2, 3, 4 iodine molecules, which means it's definitely T4. I know that some of you may be asking about cabbage, cauliflower, broccoli, kale, and goitrogens. Goitrogenic vegetables mean, or the term stands for vegetables that are capable of reducing absorption of iodine. Theoretically, this could possibly lead to hypothyroidism. But my general sense and clinical experience is that these vegetables actually do not reduce or do not increase the rate of hypothyroidism. And their benefits are such that I'm actually leaning towards feeding them more and more and more, even though on our recipe maker, it still says feed with caution, possible goitrogen, or possibly contributing factor to hypothyroidism. So remember that the benefits of these vegetables outweigh the very small chance that it could contribute to hypothyroidism. I personally like to feed these vegetables in moderate amount, and I started steaming them because they're a little like, eat broccoli raw, right? Like it's not really that great. And dogs don't like it either, I think. Some may. So remember that goitrogen may be not as much of a concern, or goitrogenic vegetables. I really would love you to tell me and write to me that after implementing these steps, your dog got better, or if you had to put him on thyroid medication, that everything is going well. And there's nothing better than seeing a healthy, happy dog with a good coat, beautiful skin, good energy. Sometimes it was a little too high energy, like packs. Oh my goodness, that dog has boundless energy. He's chewing on a bone if you're hearing that in the background, because otherwise he would be bugging me to go out for a walk. But it makes me really happy when we get email and messages from me and testimonials how well your dog's doing. And I just realized that I wasn't really showing the goitrogenic vegetables. I want to show you that. This is the group. And I wasn't showing the thyroid hormone maybe, or did you see that, Alicia? I don't think so.
Yeah, that one was showing on the screen.
Okay, maybe I just stopped sharing. So anyway, if you have any questions, now is the time to ask. And I may have some other additional additions to this little bit too at the end.
Perfect. We do have some community questions, and I echo your thoughts on the fact that we love to hear from dog lovers in the community and the changes that have been implemented and how well their dogs are doing. It's the best part of our day when we hear your dogs are doing well. When it comes to making changes, speaking of which, when a dog has been diagnosed with a medical condition like this, in your experience, how much positive change can be achieved by making changes to diet, switching to a harness, maybe working on neck health with chiro? When does it get to the point of seeing an improvement versus maybe reversing symptoms when it comes to this condition?
You know, I mentioned, it's a really good question. I mentioned that if you don't see improvement, gradual improvement after you retest in 6 weeks, then if your dog is asymptomatic, if there are no clinical symptoms like overweight, skin conditions, low energy, and so on, then you may want to actually go a little further and just retest and see if there is a gradual slow improvement. It can go sometimes for months and even years, but if it's improving, that's great. Now, if your dog doesn't improve or there's clinical symptoms that are really altering or affecting his or her life, then I would suggest to go to the phase 2, which is the thyroid hormone supplement. So it really consists of combination of your experience or your observation, how your dog is doing, and also the lab data. If things are getting worse on the lab level, then obviously you need to supplement. If there is autoimmune thyroiditis, again, you most likely will need to supplement. But in that case, and I forgot to say that, you may actually use glandular supplements, because in this case, they actually are capable of neutralizing the antibodies against the thyroid gland. Just see it this way. The autoantibodies need to bind to something and will bind to thyroid gland itself unless you provide a little decoy in the form of the glandular supplement, which you put in food, and then the autoantibodies will bind to that. So the glandular supplements in case of autoimmune condition may bind to that. To answer your question one more time or repeat, if your dog is not getting better lab-wise and clinical symptom-wise, then it may mean that you want to supplement the medication.
Excellent. Thank you so much. And the question from, let's see, Kim. Kim actually had her dog tested through Dr. Jean Dodds. The results concluded that the thyroid was fine, but said that her dog had a non-thyroidal illness. What is non-thyroidal illness? Do you know what she's referring to by chance?
Yeah, exactly. That's the NTI that I was mentioning.
Okay.
Let me just show the slide again. Non-thyroidal illness is I called it the tissue disease, or some sort of abnormal either tissue problem or organ problem or old age or malnutrition, toxicity. All that may actually result in the NTI, non-thyroidal disease, or sorry, the NTI condition, sorry, meaning that T4 does not convert enough into T3, and that's most likely what is on the results. Do you remember that T4 is the hormone that is produced by thyroid gland? T3 is the final version, much more potent than T4, that is converted from T4 to T3 in tissues. And once again, if there's tissue problem, then it doesn't get converted. So what you need to do in this case, in the case of your dog, you need to switch to natural food, provide essentials, detox your body, make sure that there is no other hormonal disease. Check there can be pretty much anything on the tissue level. Anything from organ problem, deficiency, inflammation, to even tumors or something like that, even though it's not as likely. You have to talk to your veterinarian, do more diagnostics, but address the essentials. You know, the first and second step on the healing cycle, what I call detox, provide nutrients, feed your dog right, and make sure that your dog is not stressed as well.
Excellent, thanks. Kim, I hope that was helpful just to clarify the results that you got back from Dr. Dodds. And the next question we have is from Dawn. Dawn sadly lost her dog, and the dog was on cooked meals at 8 years of age. I'm assuming it might have been to do with this condition, but she doesn't mention. She has a new puppy that's 8 weeks old, congratulations, and is trying to get him off kibble and transitioning into raw food. Her question is, when can she start her new puppy on raw food? And what is your recommendation on how to transition from kibble to raw?
I made the transition with Pax because he came from a family that one of the family members worked at the veterinary clinic, in conventional veterinary clinic, and basically Pax was fed kibble before I got him. Wasn't really happy about it, but I had to do the switch right away, or wanted to do the switch right away. It took me one day. It basically was squash, chicken. I think that it was cooked chicken on the first and second day. And then I just started feeding regular raw diet recipes, and I introduced bones maybe a week later. If you want to see how happy Pax was to get his first raw meal, go to our Facebook page and see. It was probably sometimes at the end of July there. So there's like a little Paxi Maxi eating his first raw meal, or cooked meal actually then. So right away, and most dogs are fine with it. You don't really need to, and if you don't feel comfortable with raw, just after a few days, just feed cooked a little longer. Make sure that you give the right supplements. Make sure that you don't forget to give bones. Make sure that you use a recipe maker. There's a lot of ideas and tips. There's also a course, a very short, small course on how to feed raw diet. All those are tools that you can use. I'm sure that Christina and you, Alicia, will be posting those.
Absolutely. And speaking of diet, Stephanie asks, how do you feel about kelp for iodine? Iodine was mentioned quite a bit in the slideshow. Could you revisit that and maybe expand on the importance of iodine?
Yeah. In most foods and most dogs do not suffer iodine deficiency, and therefore it's not really necessary to supplement iodine. You can, I think that there is also a possibility that if iodine is overdosed, that it has some sort of opposite effect. But I think I remember vaguely that may have been the cause, but I can't remember exactly. But it definitely is not necessary to supplement kelp and algae. If you're looking for improving your dog's hypothyroid condition and wondering whether your dog is deficient of iodine, instead of supplementing kelp and algae, do the hair test, because it'll give you a better, more accurate idea. The other thing is that kelp and algae these days, I actually seen some stats about how toxic kelp and algae is these days. And it's not exactly food or supplement that you want to give all the time. I mean, kelp and the green algae is different. Let's say for Alga calcarea, that we source just the roots, and they're tested for heavy metal free and all that. But when it comes to kelp and green algae, like sushi nori, my knowledge is that they're actually not that great to feed on a regular basis. I like these seaweed snacks that they sell at grocery store as a healthy alternative, and I just saw the stats and I'm thinking maybe I shouldn't be eating it as often.
Great. And the next question is from Lily. Lily is a two-parter. She said her dogs are doing wonderful on the Feel Good Omega. So thank you for creating Feel Good Omega. Thank you, Lily, for trusting us and trying it out for your dogs. Her question is, what do you think about freeze-dried foods? When it comes to, let's see, she's listed a few: dried turkey neck versus turkey heart, liver, or turkey thighs. All of these available as freeze-dried. Good or not good to feed?
As a supplement, I think it's not a problem. always think of how much it costs, because sometimes I find these items being suspiciously inexpensive, meaning that the dehydration process reduces the meat or the weight by about 10 times. And so if you calculate the price of, let's say, meat, when you multiply it by 10, and it seemed too low, then you go either it's sourced from somewhere third world country where we can't control the quality, or it is just too good to be true. So I always consider that, like, is the price reasonable and sensible? Is it too low for me to trust that ingredient? And quite often it is actually too low. I do not comment on any brands of food. I try to acknowledge and respect the hard work that pet food manufacturers, the ethical pet food manufacturers do. But, ultimately, dehydrated food is a second choice in my mind. When I camp with Pax, then he gets dehydrated food. But we dehydrate it at home in a regular heated dehydrator that is, it's still raw, but it's dehydrated.
Mm-hmm. You're making it from scratch, so you know exactly what's in it and where the ingredients were sourced. I do want to circle back to two of the things that she mentioned. She says that she has seen both turkey neck and turkey thighs available as freeze-dried food. Now, if it's freeze-dried and it's a turkey thigh or neck that's got some cartilage and maybe some bone in it, what does that look like compared to cooked bones, which we want to avoid?
If it really is freeze-dried and if it hasn't been heat processed, then the bone and the cartilage and all that is in much more digestible form. The only way to actually really see what happens would be to take an X-ray and see whether, how far it goes in the digestive tract. But I do suspect that it's going to be digesting just fine.
Perfect. Thanks for clarifying that. And one question to do with your slides. Layla has a question in regards to T4 and T3. She said, what do you mean by tissues?
Tissues, okay. I'm going to go back and show this to you again. It's a good question. It's hard to, I love questions like these because it makes me feel like you're really thinking about what is being explained. And sometimes it's hard for me to know whether it's clear or not. So the T4 is produced by the thyroid gland and then it's released in the bloodstream, okay? So it circulates in the bloodstream and some of it is free, it is not bound to protein, and some of it is bound to protein. But then when it gets to cells, when it gets to tissue is anything. Tissue is muscle, tissue is heart muscle, kidney tissue, it's basically cells. Okay. If it's in the cells, then the T4 gets accepted, admitted by the cells, and then converts to the T3. So that's what I mean, the tissues. And you know how it's actually converted? I forgot to say that. The T4 converts to T3 by the cells removing a metabolic process, removing one molecule of iodine, one atom of one iodine atom basically from the molecule of T3. So instead of 4, it suddenly has 3 and it's more effective. It's kind of a cool thing.
Perfect. And the last question is, you did mention that you make Pax his own dehydrated food when you go traveling, like you recently did when you were camping. Alexa asks, what is your go-to food both when you are traveling and training? Could you maybe expand on that? And that's the last question that we have from the community.
Go-to food when I'm training. When I'm training, we actually make homemade meat quinoa veggie recipe, treat recipe, and we'll be posting that soon. I think that it's actually about to be released. Other than that, when we travel, we don't really take bones. I just take my supplements, green min and other soul food and gutsins and omega. Make sure that if you travel, that you keep the omegas in a fridge or in cold temperatures. And I just mix vegetables and meat and organs. But one more thing I wanted to mention, that it has been kind of more and more clear that if you don't have organs or access to organs in your area, if you give supplements, it should be fine to feed your dog just veggies and meat if you travel, and veggies, meat, and bones when you don't travel. I do find that the organs are good if they're non-medicated, organic, if you can find them, but also make sure that you don't overfeed liver, because it can cause vitamin A toxicity, and liver, we call it liver toxicity. There's a lot to learn, but anyway, ask questions, come on our Facebook regularly, subscribe to our newsletters. Please let others know that we exist, because it makes me really happy. And I know that Alicia and Christina will agree. I have no doubt that it makes us really happy that we can make a difference in your dog's life, and hopefully how many years he'll be with you, or she. Thanks so much, and take care. Have a wonderful evening, afternoon, whatever it is in your time zone. Bye-bye. Bye, Alicia.